few years ago, I was driving down a quiet road when I came across a bad accident, a motorcyclist who had crashed really hard. They were in rough shape, clearly in pain, and I felt my stomach drop. I pulled over, flipped on my hazards, and ran to help. Another driver stopped and I asked them to call 911. I was out of my depth, but thankfully, professionals showed up fast and took over, but that moment hit me like a ton of bricks. I felt useless and I hated it. That day lit a fire under me, and I knew I never wanted to be that unprepared again, so I spent years volunteering with my local fire department, learning the basics of emergency medical response. It completely changed how I approach being out in the world. That experience really was my wake-up call, and it's why I started carrying medical gear everywhere, ready for whatever comes my way. Not long ago, I found myself at another accident, another motorcycle crash, this time with two people involved. One was hurt, but stable and able to talk, while the other was in very, very critical condition, not responding. This time I had training. I jumped into action, checking vitals and following the steps that I had learned, including my ABCs, which stands for airway, breathing, and circulation. I did what I could to stabilize the situation until a doctor and nurse arrived. Together we worked as a team, and after some intense moments, we managed to get the person stable enough for the ambulance to take over. I'm not sharing this to give medical advice, it's just my story, with details changed to respect those involved, but it showed me how much training and gear matter. That moment proved why I carry my IFAK and my trauma bag. Being prepared can change everything. Today I'll be going over my personal medical equipment, both on my plate carrier and in my personal vehicle. An IFAK, which is short for an individual first aid kit, isn't just for soldiers. It's for anyone who wants to be ready. If you're out in the woods or at the gun range or dealing with a car accident, having immediate access to life-saving gear can make all the difference. I'm not saying you're going to be a trauma surgeon, but having the tools to stop a bad bleed or stabilize someone until help arrives, that's huge. Plus, it's peace of mind. I never leave my home without mine, whether I'm camping or just running drills or even driving to the grocery store. Ultimately, an IFAK lets you take control until the pros get there. So I use the Rhino Rescue Kit. It's a solid, compact, and mole-compatible IFAK, so it sits nicely on my belt or my chest rig. I also want to say I'm absolutely not sponsored by Rhino Rescue. I just like the kit. I've customized it to fit my own needs, and I'll show you how I've got it organized. The right side is all about controlling bleeds, because massive bleeding is the #1 preventable killer in trauma. So I carry some zip stitches with me, which are great at closing smaller lacerations without a hospital trip. I have transparent dressing, which is perfect for sealing punctures to the chest or torso to prevent tension pneumothorax, which is the collapsing of the lungs. I have compressed gauze and extra dressings. These are for packing deep wounds or covering big cuts. I also have blood clot agents, which can help stop heavy bleeding fast by helping blood coagulate. I also carry an Israeli bandage or a compression bandage, which is just a super versatile piece of equipment. It's effectively a dressing and a tourniquet kind of all rolled up into one. I also carry shears to get through clothes or gear to get to a wound, and medical tape for helping me secure everything in place. So generally, I keep the right side focused on stopping bleeds because seconds count, and you don't want to be digging through your kit in a panic and not being able to find what you need. Everything's right here on the right side. It's ready to go. So now if we flip over to the left side, I have a flap section where I keep my boo-boo kit. It's for the smaller stuff, but don't underestimate its importance. I've unzipped this 100+ times for basic injuries. So inside the fold-out flap, I have some Band-Aids for scrapes or blisters, Neosporin to keep things from getting infected, alcohol wipes for cleaning wounds, smaller gauze for more minor cuts that don't really need the big stuff, and I have 2 extra pairs of latex gloves because being sterile is important. Under that flap, I've got more kind of condition maintenance gear, so stuff for more serious situations. I carry at least 2 tourniquets in my IFAK. I have more in other parts of my kit, but I carry at least 2 tourniquets in the IFAK because one's not enough if things go south. I keep them accessible for quick grabs. I also have nasal and oral pharyngeal airways. These help keep airways open if someone's unconscious or their heart fails. It's not uncommon during heart failure for the jaw to lock up and make it difficult to get air into your patient. I also have an emergency blanket to prevent hypothermia in shock victims, which is pretty common. I have a splint for stabilizing broken bones and a Sharpie for marking tourniquet times or writing notes. So the left-hand side of my IFAK is about versatility, handling everything from a minor scrape to stabilizing someone in a crisis. It's all organized so I can find what I need fast. Carrying an IFAK isn't just about gear, it's a mindset. As a civilian, you're not always going to have EMS on speed dial, especially if you're out in the sticks or in a disaster scenario. And I've added my own touches to the Rhino Rescue Kit because I want to be ready for anything, whether it's a hunting accident or a car crash or something worse. And training with your IFAK is just as important as carrying it. You need to practice pulling out your tourniquet, applying a bandage, or using those zip stitches. So get comfortable with it because in a real emergency, muscle memory kicks in, and so does tunnel vision and adrenaline. So ultimately, carrying an IFAK says you're taking responsibility for yourself and for others. It's not paranoid, it's just practical. Let's move on now to a medical bag. It's the medical bag I carry in my truck. So, it's for the same stuff. It's for a car crash, a hunting mishap, or even just a random injury at a gas station. I run the Civis medical bag, and I'm not sponsored by these guys, but they have a great pre-made bag on Amazon. It's built for trauma. It's tough enough to just toss in the back of the pickup truck, and it's got room for a more customized setup too. So I am a civilian. I'm not a medic, but I've trained enough to handle the basics like stopping bleeds, managing airways, or stabilizing someone until help shows up. Plus, it's just smart preparedness. You don't want to be that guy wishing you had a kit when things go sideways. And at a minimum, it's a good thing to keep a kit in your vehicle because if someone else with medical training arrives on scene and you've just had a car accident, they now have tools available to help you. So this bag has saved me a lot of headaches over the years. It's about being ready for the unexpected, really. So the top flap, the way I have mine set up, the top flap is all about breathing because if somebody's not breathing, that's the first priority. So I have oral pharyngeal airways. These range from an infant in size to an adult size. So I'm covered for anybody in a pinch, really. And basically what these do is they just keep the airway open if someone's unconscious. I also carry nasal pharyngeal airways. It's another option for airway management, especially if the mouth is obstructed. It's softer and easier to insert in some cases. They're super simple to use with training, but you have to practice, and you need to practice under, a doctor or someone who's licensed to help you learn how to do this. And I keep them up top for quick access. Now on to the heart of the bag, the main section. This is where I keep the heavy hitters for trauma. I have a really big bag of gauze and dressings, which is for packing wounds or covering cuts, and I've got tons of gauze because you burn through it fast. I have a CPR respirator mask, which keeps me safe while giving rescue breaths during CPR. I have a stethoscope and blood pressure cuff to check vitals like heart rate or blood pressure, especially for shock or ongoing monitoring. I have compression bandages like an Israeli bandage, again, great for controlling heavy bleedings, 3 or 4 tourniquets, and just extra gauze and bandages, because again, you just can never have enough. This section is my go-to for bleeds and vitals. On to the side pouches, I just have some extra supplies for more specific conditions. So once again, I just have more gauze. I have some diabetic low supplies, so it's just glucose gel for someone who might be having a crash from low blood sugar, and alcohol wipes and Neosporin for cleaning wounds or preventing infection. The Civis bag is built for real-world trauma. It's not just gear. It's a mindset. You need to train with your kit, know how to use every item, and keep it stocked. I'm actually due for a restock myself, but even now, this bag's got what I need for most emergencies. So whether you're a prepper, an outdoorsman, or just someone who drives a lot, a trauma bag in your truck is a really good thing to have. I'd recommend keeping it accessible, keep it ready, because you never know when you're going to need it. So there you go. That's my take on why an IFAK and a medical bag is a must for any civilian, and how I've set up my Rhino Rescue IFAK and my Civis medical bag for, maximum readiness. Get yourself a quality IFAK, customize it to your needs, and train with it. It could save your life or someone else's. Let me know what you carry in your IFAK in the comments below. Don't forget to like and subscribe. And thanks for hanging out. Thanks for watching. I will see you in the next one.